Coming up tonight, communicable diseases and the need for public to remain alert. Family law decree breakthrough for women. And planned water shutdown for Nausori area. Good evening, I'm Sandra Assam. The result of the two devastating floods earlier this year has been a number of coincidental incidences of communicable diseases. The Health Ministry, in partnership with the World Health Organization, has collated a number of cumulative figures of communicable diseases in the Western Division, with more males than females affected, ranging from the age of 10 to the 39-year-old category.
The Health Ministry has collated to date 160 cases of dengue fever, 236 for leptospirosis and 117 for typhoid cases, and these are all confirmed laboratory cases. More than 96% of these cases are being treated and sent home, whilst 4% of the cases are very sick and are still under medical treatment.
In terms of the localities, with the localities, most cases occur in the suburban to rural areas, in the suburban, sub-rural and rural areas. It differs between the diseases. For dengue, mostly in the suburbs, town areas and city areas. For leptospirosis and typhoid, mostly in the sub-rural and rural areas.
So far, there have been several deaths due to suspected cases of leptospirosis. National Advisor for Communicable Status Mike Kama says cumulatively there are 17 suspected cases of leptospirosis and only 7 cases confirmed.
With regards to what the ministry is doing at the moment, there's 2 activities the ministry does: control and prevention. Other activities are quite technical with surveillance and laboratory investigations. So with control and prevention, the control activities we're doing is internal communication within the Ministry of Health. We've been trying to raise the index level of suspicion for our clinical workers out in the field, in the subdivision, the health centers, in the subdivisional hospitals, and also in the major hospitals, for them to have a high index of suspicion of communicable disease after these disasters.
In terms of control, Kama says health officials in the field are well trained, well equipped, and more drugs available to cover those who are infected with communicable diseases. The teams are working in conjunction with the World Health Organization to address the issue of communicable disease.
Majority of women coming out of a de facto relationship will now be in a better legal position due to the Family Law Amendment Decree for 2012. The Attorney General and Minister for Justice Aya Syed Qayyum says the change approved by Cabinet yesterday will be a major breakthrough for women.
Previously, well, let me take you back to the Law Reform Commission recommendations that was done quite some time back, before the Family Law Act was put into place. There was a recommendation in the Law Reform Commission that de facto relationships needed to be recognized also. At that time, obviously, before the Family Law Act was approved, appears to be some sort of deal was done between the women's rights groups and, or some of them anyway, in the government of the day, where de facto relationships weren't recognized. At the moment, well, before this decree was approved by Cabinet yesterday, a child born out of a de facto relationship was recognized by way of one of the parents having to pay the maintenance. Some of these people got married before a religious person, you know, in church or temple, whatever the case may have been, but did not get legally married, but lived in a de facto relationship for 5, 10, 15 years, some of them. If that relationship were to end, then apart from the child maintenance, nothing else, the spouse would not have, one of the spouse would not have the entitlements that they would normally have. What Cabinet has done yesterday, through its approval, has said that de facto relationships need to be given recognition also. So in other words, in respect of spousal maintenance, in respect of properties that may be settled, as you would if people were legally married. This is an enormous enormous breakthrough.
Majority of the areas within Nausori will be experiencing water supply disruptions from 2 p.m. to 6 p.m. tomorrow, Thursday, April the 26th. This is due to a burst 450 millimeter water main at the junction of Vudi South and Waituri Road. The Water Authority production team will be repairing this burst water main, and during this period and during the course of their work, supply will be disrupted in the following areas.
Areas affected are all areas within Verata to Mbaulevu, La Kena and Buindona areas, Dautata, Watoa, Ovea, Mbau Island, Ndrabo, all villages along the Mbau Road and Nakelo Road, District of Nodo, Ndreketi, Mburembasanga, Tokatoka and Buretu, Cuba, Naselai, Vandrai, Wainbokasi Road, Bunimono areas, Wainbokasi Hospital and Mokani Health Center and Nausori Airport. Residents living along these areas are advised to store enough water to last them more than 10 hours. Supply is expected to be restored to low-lying areas on Thursday night, while the high areas will gradually be restored till the early hours on Friday morning.
Coming up after the break, remembering those who sacrificed. Fiji takes lead as first Pacific Island country to approve HIV/AIDS decree in workplaces, and new Town Planning Act in line with current development trends.